A very bleak picture indeed here in South Sudan, and the situation I think is going to get worse given that there's been fighting here since December, and even in this hospital hundreds of miles away from where the fighting was I've met women who've fled here to have their babies, so things could get a lot worse. One thing that needs saying though is if you look at the welfare of children, as I was saying in my report, generally then there is a better picture. The number of children who die before they're 5 years old, well, that figure has halved from about 12 million every year to something like 6 million. But it's those crucial 24 hours, first 24 hours of a baby, where there still seems to be such a challenge. Back to you now, Lucy.
George, thanks so much for joining us from South Sudan. Well, let's take you through some of those figures that George was mentioning as well, because in many ways, the steps taken to reduce infant mortality around the world can be seen as one of the great medical success stories of the last 20 years. Let's take you back to 1990, for example. As George was saying, the number of children under the age of 5 who died every year stood at a massive 12.9 million. And when we fast forward to 2012, that number has actually gone down to 6.6 million, a drop of almost half. The story, though, in India is still dire. Even now, 598,000 babies a year are either stillborn or die on their first day. That is almost a quarter of the global total for such deaths. These figures we're getting from Save the Children. But also in India, just to tell you, this is a staggering statistic. More than 60% of women say that they gave birth without a skilled healthcare worker. The figures for a number of other countries in Asia are just as shocking as well. But let's stick with India for now and talk to Thomas Chandy, who is the CEO of Save the Children in India and who joins me now from Delhi. Thank you for being with us. That seems to be the figure that really leapt out at me, that 60% of women in India don't have access to a healthcare professional. Is that the key worry for you?
Well, I think while we look at this entire tragedy that is playing across the world, we in India, without taking the seriousness of this away, we are looking at it with cautious optimism. There is also a case to be, in some sense, to be jubilant and to celebrate, because if you look at the numbers of the Indian mortality, child mortality, the numbers are beginning to the rate of decline is beginning to has picked up some momentum, and it is moving faster than before. And if you look at the numbers from 1990 till 2012, when the last numbers are available, the Indian child mortality has almost halved, or more than halved. It's about 54%, as against a global average of 44% reduction. In India, when things happen because of the absolute scale and numbers and the large population, I think there is a reason to be happy, because if we can fix the problem in India, which has got the largest number of children living here, I think we can fix the world. So there is reason. And also, if you...
Thomas, sorry to interrupt, but there's still a huge problem when India has the highest number of combined first day and stillborn deaths in the world. You say there's been this big improvement. What has been done and needs to be done in those areas where it's still bad?
Well, I think if you really look at the issue, as I said, that there has been improvement, and improvement also has happened due to concerted efforts in the last several years, and especially what has really picked up momentum in the last few years in fixing the health system, and there is a larger need to or awareness of inequity across systems. We know that the country has been economically growing, but when the economy picks up and grows, that also leaves behind a large number of poor people who is much worse off. And that inequity means inequity of inequitous services, service distribution, and so on. And so there has been a greatest focus on identifying where the issues are, where the mothers are dying, where the children are dying, and go into those areas with government schemes and so on. So we just released the report this morning in India, and I must tell you that it was received, as I said, with cautious optimism, because things are looking up.
Thomas Chandy, I'm pleased to end it on a positive note. Thank you very much for joining us from Delhi, the CEO of Save the Children in India there.